Welcome to the first episode of the series on chest X-rays. We are going to kickstart with a concise, systematic approach to reading the chest radiograph. In a 4-step approach, we are going to see how to identify the image, check out if it is adequate for reporting, see the areas of interest. The main purpose of identification is to cross-check the patient information on the image to ensure that there is no mistaken identity and misreporting. Once you have ensured that it is the right patient, then you need to look for the marker on the image that denotes the side of the patient. Once identification is complete, you can move to check whether the image is adequate for reporting. A routine chest radiograph is taken in good inspiration. The best evidence of a good inspiration is to count the ribs. The anterior ribs are seen curving infromedially from outside towards the midline. A 6th or 7th rib hitting the dome of the diaphragm suggests an adequate inspiratory chest image. Next, look at the medial margin of both clavicles. These margins should be equidistant from the spinous process. This would suggest that there is no rotation. Another evidence is to look for the spinous processes of the thoracic spine. If they are appearing aligned vertically, that means there is no rotation. Why do we emphasize on rotation? Because findings on either side of the chest can be false positive or false negative just because the film or the image is rotated. To ensure that you have a well-exposed film is to look for the vertebral bodies and the intervertebral disc spaces that are seen behind the heart. If you're able to just see the intervertebral disc spaces, that means the exposure is spot on. Now that you have figured out that you indeed do have the right patient's X-ray and everything is marked well and you have an adequately taken image, you can move on to looking at the structures. Now, we need to have a systematic approach in looking at the image so that we do not miss out on findings. Broadly, we can divide it into 2. 1, the lungs. 2, everything other than the lungs. The easiest way to look at the lungs is to divide it into 4 zones. The boundaries of these zones are not arbitrary. These are for visual detection of abnormalities and easy communication of findings. So we divide each lung into 4 zones: apical, upper, mid, and lower. Apical zone is the area of the lung above the clavicle. Upper zone is the area below the clavicle, stopping short of the hilum. Mid zone is the area corresponding to the hilum, and the lower zone is the area below the hilum. Now that we have covered the obvious areas of lung, we also need to look at the hidden areas of the lung. There are certain areas of the lung which cannot be seen in a frontal chest projection. One such area is the retrocardiac area, and the other is behind the diaphragms. So we can denote them as to the right of midline and to the left midline. Once we have gone through all areas of the lungs, we can start looking at the non-lung regions. The non-lung regions are broadly divided into the mediastinum, which includes the heart, the upper abdomen, and finally the chest wall, which includes the scapulae and the visualized areas of the shoulders on both sides. So with the small checklist, we will actually be able to start reading a chest radiograph and make sure that we do not miss out on any findings. In the next episode, we will learn how to identify structures in a normal chest radiograph.